Good morning, everyone. So, as this is Dr. Seema Balian, and today I'm going to give you a presentation with regards to the OSCE. Now, we all know that what exactly, we have heard this name a lot of time about you going to give an OSCE exam, and everyone will require to give this OSCE exam. It is a practical exam, which is towards your your registration. So I will talk about OSCE in more detail and give you a little orientation on what exactly is OSCE and what all other things which you will need to do and what other things that you need to be aware of. Yeah. Before I move ahead, I'll just request all of you to just put your audio on mute, please. All of you, if you can mute it. Okay, yeah, thank you very much. Yeah. So, okay, so what is NMC OSCE? So all of us, as I said, that we have heard a lot of time that OSCE is one of the main thing. A lot of people, they get quite excited about it. A lot of people, they get worried about it, that they have to go and do this OSCE exam. So as you know that in the NMC registration process, there are a few steps that you go towards achieving the registration. Out of that, the first and the foremost step is that when you are giving your English exam. So once you get your English exam, then you have to give a theory exam, which is the CBT, or the computer-based testing, which tests your theory aspect of it. Now, after we have tested the theory aspect, then we have to actually check that how are you practically. So in delivering the all the nursing job that you will be required to do. So that basically forms your OSCE exam. So the full form of OSCE is Objective Structural Clinical Exam. As it says clinical, so it is based on all your clinical knowledge. So this will test the practical aspect of your eligibility towards the NMC registration. And currently it happens only in UK. As you know that CBT and the theory exam you can give in various parts of the world as well, but for the practical aspect, it only happens in UK. So you will have to be over here to give this exam. So about the test centers. So OSCE exam is conducted by 3 universities in UK. So these are the Northampton University, Oxford Brookes University, and Ulster University. Ulster University is in Northern Ireland, and Oxford Brookes University has 2 campuses. One is their Swindon campus and one is the Oxford campus. So currently where I am based in Swindon. So I live in Swindon. Yeah, so these are all the places where you can take this exam. Now, if I say that from Shrewsbury, I think the furthest, actually all 3 of them would be around the same distance. But Northern Ireland, because it is in the Ulster University, because it is in Northern Ireland, you will either have to go via sea or via airplane. So, but the distance wise, it takes almost the same time. Although majority of the time, if we are going to Ulster, then we go a night before and we stay overnight over there, so that early in the morning, because the exam starts early in the morning. So what we don't want is that rushing early in the morning and having the risk of getting delayed and all that sort of things. Yeah. So your exam, because before the COVID situation, the exam for the second batch of people, that was already booked. And it was booked for the 5th of May. I think most of you would have got confirmation as well. But and that was in Ulster University. So once this COVID thing open up, then it is more than likely that your exam is going to stay in Ulster University itself. Yeah, I have got very good reviews for this one, although all of them. So our various nurses, they have given exam in they've given exam in Northampton, they have given exam in Oxford, and everyone is like very good, very supportive. So the exam test centers are all, and they all work in with the same criteria. They all have the same sort of pattern of the exam. So it is nothing like that one test center is better than the other. It is nothing of that sort. Okay, so what to expect in a test center? Now, there are, again, because you are going for the first time, so sometimes people are more, you are nervous anyway, because obviously you are going to give an exam. Yeah, but there are certain elements which increase your nervousness because you are going to a place which you have not seen before. Sometimes you don't know that what kind of a setting is in the exam test center, what to expect in the test center. Yeah, so that's why people sometimes they get a little bit apprehensive. So I just want to assure you that when you will come to Mysore to give your, or to do your practical exam, your practical exam training, I think in that we have tried to make the training center as close to the test center as possible. So it will be almost similar to how you would be training. The equipments and otherwise the questions and how it is done is almost the same. So if we see, then there are, and as although I have written that different test centers are slightly different, but the slight difference is more in the design and all that sort of thing, which you would expect. So, but all the test centers, they will have like a patient bay. By patient bay, it means that it is just like the patient cubicle. It is going to be there, and for each station, you will have a different cubicle where you will need to go. There is an examination area, which is where you all will be sitting before you actually go into your exam. And there will be an invigilator to help you to see that all the exam process is going on absolutely fine. In each bay, when you enter into your cubicle, there is going to be an assessor. Yeah, so someone who is actually assessing your exam. So you are always expected that you should go into the cubicle not thinking that there is an assessor, because for you have to go and see your patient and do the task that is assigned to you. The assessor is over there, but you are not supposed to talk to the assessor, or you are not supposed to acknowledge that yes, there is an assessor. Okay, so before you go into the exam, there is another place in the examination area outside these patient bays. There is most of the time there is a place where all of the instruments will be kept. Yeah, so those are like your thermometer, your blood pressure, cough, then if you're the oxygen saturation probe, and like the pulse oximeter, all these things are going to be over there. So the IM injection things, the IV sort of sets. So you can go and you can see, you can familiarize yourself. So you can see that, okay, what type of a thermometer is going to be used over there. So when you go into the examination bay, when you are going to give your exam, then you are familiar with all of those instruments. Although when you come to Mysore, again, we try and use exactly the same equipments which are being used in the exam. So you will already be aware of how to use those things. But just in case, even if you don't know, if there is something which is slightly different, before you enter into your exam, you can always ask the invigilator over there, and they will be happy to explain it to you that how you use that instrument. Okay. Please keep on giving the thumbs up if you all are able to hear me, and if you are fine with this. Yeah. There's one more thing, that all of the exams, they are recorded. Yeah, so, but the recording is, again, not that they are going to check the recording later on or something of that sort. But sometime what happens is that sometimes you feel that, no, you did something right, but the exam result depicts something different. So if you want to challenge that, then there is a recording for that, which is used for the moderation purposes. That just in case if someone has challenged the result, then they can go back and look into the recording, and accordingly they can either give you the feedback, or they can change the result if they feel like that it needs to be changed. Okay, so this is like a typical setup, what you will see over there. So in this room, if you can see that there is over here, this is the table, which most of the time the invigilator or someone will be sitting, or the assessor will be sitting. So you will enter from over here. In except your assessment session, in a majority of all of your skill session and other stations, you will have a mannequin. There is not a real patient. So this is the mannequin, you can see, but you will need to act with the mannequin just like a real patient. There is a clock which is going to tell the timer, which is going to tell that how much time you are left. There is usually a hand wash area, and there are bins of various kinds. Like if you are going to do a dressing and things, so there will be a yellow bin, which is for your clinical waste. There will be a black bin, which is for your domestic waste. Yeah, so there is a call bell. This one, if you see, it is a call bell, which majority of the time you will need to tell the patient to use the call bell to call you. Then the beds are remote controlled ones, so you can lower or raise the bed with these ones. So this is a typical setting. This is a hand wash, and these are the tissues where you can wipe or dry your hands. Okay, so this is like a typical setting, although as I said that there is a slight difference which can be there, which is possible. Yeah, but majority of the time this is how the setup is going to be. Okay, now equipment, as I've already mentioned, that all of the equipments are provided, and they are all standard and very commonly used equipments, and you will be given time to familiarize yourself in the orientation bay. Okay, there are some other, like as you can see, some other pictures I have added for the equipments and things. So this is your gases sort of thing. You can see a mannequin. There is a umbu bag and your respiratory sort of thing, which you use for BLS training. This is more of what the call bell is going to look like. This orange button is to call for help. The patient, they can press it and they can call for help. Yeah, this was again the control for the bed. This is just a picture of a British National Formulary, or BNF. Now BNF is another thing which you all will have to get used to. It is just like, I don't know if you have heard about MIMS in India. So it is basically, BNF is a book which tells about all of the medications which are used in NHS. So if you have to look up about the information, dose, interaction, actions, reactions, anything about any medication, then you consult the BNF. So when you will come in my suit, then we will tell you that how to use a BNF and how you can get yourself familiar with it. Okay, any questions till now? Okay, if nothing, then we'll move forward. Then there are some more pictures. Yeah, so this is like how a mannequin will look like if you have to do a dressing change. So there will be like any part of your your limb, or it might be abdominal dressing, or it might be an arm, where the dressing is going to be like that, and you will require to change the dressing. So you can see someone over here trying to change the dressing, and this is like someone trying to take the blood pressure. Yeah, and you can see this is a pulse oximeter over here. Okay, so a little bit more about the exam. Okay, so I think that I'll just ask everyone to mute, please mute. I think someone has not unmuted it. So anyway, coming back about your exam. So OSCE exam is usually the whole of the exam. It takes around 3 to 4 hours, but it is done in batches. So say if all of you were booked to have an exam on one day, but what happens is that your time might be different. So like one batch is going to start at 8 o'clock in the morning and they will finish by around 11:30 to 12 o'clock. The second batch is going to start by say 9:30 and they will then go on accordingly. So the idea is that the batches, they should not overlap with each or they should overlap with each other. So they are not able to tell, because on one day, it is the same station for everyone. So they don't want people meeting with each other and telling that what station is there in the exam. Yeah, so but it is usually 4 to 6, 4 people who will go in one go for the exam. Yeah. So, so it takes around 3 to 4 hours to complete for one person. The total, the stations that you have to do are 6 stations. Now in the 6 stations, they are divided into 2 types. One is an APIE, where there are 4 stations, one station for A, P, I, and E. So there are 4 stations of that, and there are 2 skill stations. Now we will go in more detail what APIE means and what skills means. So we, in the subsequent slides, we will see that. But this is, you will need to sit 6 stations. Then you will also get all of your documentation checked at the same time when you go for your exam. Sometime your documentations are checked before you enter the exam. Sometime they are checked after you have completed your 6 stations. Now by documentation check, I mean that all of those documentation that you will that you have submitted to NMC, over here they will be checked, their originals will be checked again. So you will need to show your degrees, your registrations, your all of the work experience things or mark sheets and all those kind of things you will need to show over here. It usually takes about 10-15 minutes. And all of your documentations are checked and they will then update your NMC that all the documentation are in place. So once you have given the exam, the result usually takes around 5 working days, but sometime it comes a little bit early, sometime it can take a little bit later, but usually it is around the 5 working days. If your result is favorable and you have passed, then we apply for the PIN number. Now in your case, I think almost all of you have started with this new process. So if you have started with a new process of registration, then you have already paid the registration fees. So they will, as soon as your result come and if your result is favorable, then you will get your PIN number within the next 2-3 days. If you are still carrying on with the old process, then we will have to pay your the registration fees of £153. And then once you have paid that, within a day, you will get your registration number. Your registration number is then given to the HR department, although the HR department of the hospital will also keep a track of it. And as soon as you will get your registration number, your contract will automatically shift to a band 5. Before that, till you give your exam, you will still continue on band 3 or 4, whatever is the contract says. Yeah? Okay. Now, as I said that APIE, let us go in a little bit more detail about the APIE. APIE is the 4 stations of the exam. Now, they stand for A is for assessment, P is for planning, I is for implementation, and E is for evaluation. Now, I'm not in some way or form, you have heard about all these things and you have been already doing all these things in your nursing practice. So don't get alarmed by that it is anything new. It is the same sort of thing, but they have just put it in a sequence. Yeah, so each station in APIE is for 15 minutes. You will, so you will get 5 minutes to read. So there will be like, before you enter into the cubicle, you will be given 5 minutes to read the scenario. So that what scenario it is. And then you will, after 5 minutes, once you have understood what the question is and what the scenario is, then you go in the cubicle and do according to the question. Now, APIE is always in this same sequence. So you will always have assessment, planning, implementation, and then evaluation. It can't be that you do the evaluation first and then you do the assessment. It can never be like that. API is always together, and it is always going to be it is the same patient's journey that you take. So the person that you have assessed, you are going to write the care plan for the same person. You are going to write the do the implementation for the same person, and you are going to do the evaluation of the same person as well. Although sometimes the only change that can happen is that when you did the assessment, at that time the patient was pre-operative. But when you are writing the care plan, by that time they will tell you that, okay, now the patient has undergone the operation and now it is the post-operative patient. Okay, so this can be a difference, but otherwise the patient is going to be the same. Now, planning and evaluation are silent station. By silent station, I mean that it is only going to be you, a desk, and your pen and a paper. So because there is nothing to discuss in the planning or evaluation, so you will be given 15 minutes in which you have to write two planning activities, like the two major problems and what plan you have for the patient. And in evaluation, either you will need to write like a discharge letter or a transfer letter. Now, these again should be something which you have already practiced when you are giving your OET exam. So because in OET exam, when in the writing task, as you will see that you have to write a referral task of something, but it is similar to this one. Yeah. So then the assessment is again the only station where you will get a live patient or an actor who will be playing as a patient. Rest, every station, there is going to be a mannequin. Okay, are you with me, everyone? Yes. So in the 6 stations, APIE is always going to be together. So it cannot be that, okay, one is coming between assessment and planning. It can never be that there is a skill station. No, the skill stations which you are going to get, they can be either before APIE, they can be after APIE, or it can be that one skill station, then APIE and the other skill station. But APIE is always going to be together. Okay. So now coming to the assessment, we'll go a little bit more in detail for the assessment. Now in assessment, as I've already said, that you will get 15 minutes to complete the station. The assessment will usually take, in the assessment, you will usually take a brief history and then you do a routine observation. So which you are again very, very used to doing that thing. Because when you see in your normal day-to-day practice, when you are seeing any patient, this is exactly how you do. That you will be going in and you will be doing some kind of a brief history taking, and you will do the observations. Now the observations are again routine observations. So you are supposed to take a blood pressure, you are supposed to take pulse, and you are supposed to take pulse, you are supposed to take temperature and the respiratory rate. Now there is a way how you do these things, but that is the way that will, which you are already doing. It is nothing different in that way, but there are certain things that you will have to just tweak here and there. Like say, for example, when you are taking a blood pressure cuff, you have to make sure that it is in the correct arm that you are taking, the correct size of the blood pressure thing. You have to make sure that the arm is not hurting or anything of that sort. There is no IV line in that arm which is still there. So you have to make all these things. You have to make sure that this is there. And also throughout this exam, one very, very important thing is a verbalization. By verbalization, what exactly I mean is that, see, it is like that if you are giving an exam, how is an examiner going to know that what is going on in your head? Yeah. So until and unless you verbalize that, so you will have to tell, so you might be thinking that, okay, I have looked at the patient's arm and I know that there is no IV fluid which is going on, and that's why I'm going and using or taking a blood pressure in that arm. But unless you verbalize that, the examiner is not going to be able to know that whether you have checked that or not. Yeah. You might have checked it, but that is only in your head. So when you are going to go ahead and do this, you will have to verbalize that okay, I have checked that I've seen that in your arm there is no IV fluid, IV cannula which is there. And so it is safe for me to use this arm. I also see that there is no bruising or no any other abnormality which will prevent me from taking the blood pressure from that arm. Yeah. So when you have said all these things, then your examiner knows that yes, you have checked all these things. So in each and every station, whatever you are going to do, you will have to verbalize. So you will have to get in a habit of this one. Yeah, it might sound slightly weird when you are doing it, but this is the only way that you are going to be able to tell the examiner that yes, you know what you are doing and why you are doing those things. Okay, like again, if you are taking pulse, so pulse and respiratory rate, we usually do it together. Yeah, but it is for 2 minutes that you have to do. And when I say 2 minutes, then actually I mean 2 minutes, because the examiner is going to be checking that you have checked both the things for 2 minutes. Now in that 2 minutes, 1 minute is going to be for your pulse and 1 minute is going to be for your respiratory rate. Now, we usually don't tell the patient that we are also going to check your respiratory rate, because out of all of the parameters that you will see, respiratory rate is the only thing that the patient can actually control. Yeah. So you can control that whether you breathe fast or whether you breathe slowly. So pulse you cannot control, your temperature you cannot control, your blood pressure you cannot control. So if we tell about that, okay, I'm going to check your respiratory rate as well, so that might actually make the patient conscious, and he might actually either start breathing very slowly or start breathing a bit fast. So you tell the patient that, okay, I'm going to check your pulse for 2 minutes, and in this time I just want you to relax and just don't talk. Yeah. And after the 2 minutes, then you will tell the patient that, okay, in these 2 minutes, I have checked your respiratory rate as well as your pulse. Yeah. So this is something that, again, these are the things which you might be already doing, but these are the things which you have to really show that it is that you have done these things. So the OSCE exam is actually showing each and every step. So that how you are doing and why you are doing. So you need to show all these things. Okay, so this is one of the things that you will actually need to practice and get used to. Okay, then depending upon in the assessment, so you are going to do a brief history, you are going to take the observation, and along with that you will need to fill out a chart. Now, by filling out the chart, I mean that there is, now you have taken the observation. So you have to write these observations somewhere. So that is where you will need to fill a chart, and you will need, I don't know whether you have heard about news chart or a GCS chart or a TPR chart. You would be doing that. So according to your observation, usually it is some numbers which are given, which will tell that whether your patient is critical or whether your patient is okay. And depending upon that, you are then going to do that whether this is a critical patient, and that's why you need to take the observation every half hour, or whether you will say that, okay, this patient is a very stable patient and I can do routine observation after 6 hours or 12 hours. Yeah. So in the next slide, I'm going to try and show you subsequently, I'm going to show you all the charts and things as well. So which will give you a little idea that what they are. Now coming again in the assessment, continuing with that. So we have to see that assessment can be of two types. Yeah. So either it can be an in-hospital assessment, or it can be an assessment based in a community setting. Now you are a nurse. So a nurse can be a nurse in the hospital, or a nurse can be a nurse in the community. Yeah. So a little bit in the brief, I want to tell over here about how the NHS works. So NHS is like primary care, secondary care, and tertiary care. Like even in India, it is like that there is our primary care, secondary, and tertiary care. So the in-hospital things, they are tertiary care. You are in the tertiary care thing. Primary care is where the GPs are there, general practitioners are there. So your routine day-to-day, any illness that you are coming across, you are going to go and see your GP. And the GP is subsequently going to decide that if there is anything for which you need to be referred to the secondary or the tertiary care. Yeah. Again, after anyone who is discharged from the tertiary care, from the hospital, they are coming back into the community. So, but when they come back in the community, say there is a patient who has been discharged with the dressing. Now there is a letter which will go to their GP that, okay, or the nurse, a community nurse, a letter will come to her saying that, okay, this patient has been discharged back into their home, but their dressing need to be changed in a week's time. Now that is exactly how you would have learnt in OET when you were doing your OET exam as well. Yeah. So now this is the nurse who is going to do a home visit to change the dressing of the patient. Yeah. So that is what I mean by saying that there is an assessment which can be done in a hospital and there is a community setting assessment. Now the observation chart also depends upon that whether it is an in-hospital observations that you are doing or you are doing in a community. Now in the community, usually you would not have like a pulse oximeter and all those kind of things which you are having in a hospital setting. Yeah. Also in the community, you cannot have the chart which is going to say that, okay, I'm going to do observation every 30 minutes. In a community, you are not living with the patient. Yeah. So you will come once in a day or maybe once in a week to see the patient. Okay, so that is how the observation charts also differ from in hospital setting and in community setting. Now, when you are doing assessment, as I've already said, that your verbal, non-verbal communication is going to be assessed. So communication is one of the things which is very, very important. As important as how you are doing the observation, how you are communicating is also very, very important. Yeah. So in the 15 minutes, you will have to do your chart. You will have to complete the chart. You will have to calculate the score and you will need to do the signing and thing. Also, you will need to advise the patient that, okay, this is the score which has come. And according to this score, this is how we are going to observe you. Okay. When there is one more thing that you will need to consider activities of daily living. So one or two things which is going to help you in the ongoing station. So imagine that you are doing the assessment and thing. Now you need to check with the patient that, okay, if for example, there is a patient who has come with a dog bite. Yeah. So with a dog bite, you do all the assessment and thing, but you will also check that, okay, whether you are able to otherwise, how you're living sort of thing when you go home, that how are you going to be able to walk? Are there stairs to climb? If it is a dog bite in the leg, that whether you will be able to do that. If you are otherwise like constipated or diarrhea or some kind of eating nutrition, malnutrition, all these kind of things. So your activities, that how you are, the other things which you are going to briefly check, that which might affect your patient. Okay. So again, now, as I said that about the charts, then if we come back, so the in-hospital charts, there are news chart and there is a GCS chart. Now, news chart is the chart which, as I was saying, that is a chart where you are going to fill and calculate the score in a routine observation. A GCS chart is the chart for the patient which are either unconscious or come with a head injury and things. So all of you would be aware of what GCS starts for. It's the Glasgow Coma Scale. So it is there. And in the community setting, there is a TPR chart, which is a temperature, pulse, respiratory rate, simple one. There is a MUST score and there is a PHQ-9. Now, I'm not sure that everyone would have heard about MUST score and PHQ-9. Yeah, but we will go through them one by one. Now, let us see, let us bring up the news chart. Okay, this is a typical news chart which we have already filled. Yeah. So if you look into this, yeah, so you will see that there is the name of the patient, their date of birth and their date of admission. Yeah. And then it is going to be that you will need to write today's date, the observation, the time of your observation that you are doing that. And then there are various sort of things. So there is respiratory rate. Then there is oxygen saturations, whether the patient is on air or on oxygen, blood pressure, pulse, their consciousness, and the temperature. Okay, so now according to that, say for example, in this one, if we say that the patient respiratory rate was 21, yeah, so you have filled over there 21. Now in this one, if you will see all the white columns are your normal observations. Yeah, so there is a 0 mark given.
Sorry to interrupt you, ma'am.
Yeah,
You're showing the introducing OSCE, the beginning one you're showing. Actually, I cannot see the chart.
can no one see the chart?
No, ma'am. No,
ma'am.
No, ma'am.
Okay.
It's just the introduction.
First slide, it is showing the first slide only.
Okay, let me just go back then. So you are just seeing this one, is it?
Yeah.
Yes, ma'am.
Okay. Okay, what I'll do is that I'm going to send these. There is some issues which is happening, but I can only share one thing at a time, so I can't share two things. So at the end of this presentation, I'm going to show you all of them. So then I can stop sharing this one and I can start sharing that one. Yeah?
Yes.
Or maybe
Okay, ma'am.
Yeah, let us finish that, and then I'm going to show you all of them. Just make the note that of news chart, GCS chart, TPR, must score, and the PHQ-9. Just make a note of that one. Okay. Fine. So in we have seen that in hospital setting. So these are the type of different charts that you will be able to or you will be getting, and you will need to complete all those charts. So then once you have done that, then so you will be required to just not only fill all those things. So in 15 minutes you will need to finish those charts and do all your observation and plotting and signing and everything. And if you go according to your system, according to a plan, then 15 minutes is more than enough for you to do all these things. Yeah. So then once you have done your assessment, then you come on the planning station. Now the planning station is, as I said, it is a silent station. You will be given 15 minutes to write that, and you will need to write two relevant aspects of the care related again from the scenario. So you will have to choose two problems. Say again, going to the same example, that for example, that there is a patient who has come with a dog bite, and it will say that, okay, she is a patient who actively plays tennis, and the dog bite is on her left leg, and she has a tennis tournament in, say, about 2 weeks time, and now she is worried that whether she will be able to play in her tournament or not. So this is a kind of a scenario. Now in this scenario, if you will say that if you have to choose two relevant aspects of the care. Now see, the first and foremost aspect of care is that because she has come with a dog bite, so pain is going to be one of the problem. So you will have to sort out her pain. Other problem is that there is a risk of infection because it is a dog bite. So there is always a risk of infection. Third problem is that the patient is having problem that she is anxious about her attending her tournament, that whether she will be able to do that or not. Yeah, fourth can be because it is her leg, her mobility is an issue, that whether she will be able to do all her daily activities and be mobile or not. Yeah. If we go on the fifth sort of thing, there can always be that there is an aspect that about if you're taking painkillers and if you're taking antibiotics and all that, there can always be a risk of constipation or diarrhea or those sort of things. Yeah. So if you see, just with a few lines which I have told you about the scenario, we have been able to spot almost 5 problems which can be there, for which you will need to take care of. Now we have to write the two out of all these 5. We have to pick up the 2 most relevant and most important things that you will be able to take care, or you will be do the planning for. You will be doing the planning for. So you pick 2 most important ones. Yeah. So if we say that, okay, we have picked up, so pain is going to be the foremost thing, because rest everything can wait. So pain is going to be the first thing that we will have to deal with. So pain becomes your first problem. The second problem obviously is your risk of infection or the anxiety of the patient. Yeah, so you take that as a second problem, and then you write the plan according to that. Now you will get a set page which is going to, I'll show you that as well, that how the set page of the care planning is going to come. So you will get a limited space to write it. So you cannot go on and on about writing it. So usually we say that you will need to write about 4 or 5 sentences of each care plan, maybe 6, yeah, depending upon your handwriting and all that. Now, and so you will write in the first sort of thing, say for example, you are going that the pain is your main problem. Now, any problem that you choose, that problem needs to be SMART problem, or it needs to be specific, it used to be measurable, it is something that you can relate to, and it has to be time bound sort of thing, and you can take a correct action on that one. So once you have, so pain is something that you know that it is a specific thing. There is a pain score that you know, and you can judge that, you can assess that, you can give a treatment for it, and the treatment you can expect a time bound result for that as well. So if you've given a painkiller, you know that within the next 4 to 6 hours, the pain should start getting down because you have given the painkillers. Yeah. So this is how you will need to use that. So first, and we will take you in more detail about how you write the care plans. But care plan is one of the things which sometimes people find it pretty difficult. But if you get the hang of it, I think that it is one of the simplest sort of thing, because again, it's a silent station. There is no, anyone is not involved. It is just you have to think and you have to just write it. There is a set pattern for you to write this one. It is just again like your OET, the practice is what matters, that how you need to write this one. Okay, so it is, so the planning, when you go in a planning station, you will be given a black pen. So everything that you write in this one, you will write with a black pen. And you have to make sure that your writing is clear and legible, because if they can't read what you have written, then there is no point in writing. Yeah. And you have to be very, very specific about not to rewrite, overwrite, or cross out. If you have to cross out, then there is a single line that you use to cross it out. Yeah, so you should still be able to read what was written underneath that line that you have crossed. Yeah, and then on top of that, you can write whatever you needed to correct, and then you do your initials. Now, this is in order to make sure that it is you who has done that crossing out, and it is you who have written that thing. Okay. So that is what I've written. A single cross with the initial on the top can be accepted. So once you have done the planning sort of thing, then we come to the implementation station. Now, implementation is where you are actually going to give the medication. Okay. So in implementation, you will be given a drug chart. There is going to be a scenario that, okay, this is the same sort of patient, and now you are going to go and give and you have to do the implementation. So you go in and you will find that there is a drug trolley and there is a drug chart which is there. So you will then need to go through that drug chart, and accordingly you will have to dispense the medication. Now there will be around 3 to 4 medication which are going to be over there. The drug chart has various sort of sections to it. So the front page, the first page is always of the patient details, that what their allergy history. In the second page, when you go, then usually it will start with your stat medications which were given. your PRN medication which are given. Then you start with your regular medication. Regular medication, most of the time they starts with your antibiotics, your painkillers, and all those sort of things you will go. In the end, you might find that there is a place for a fluid. There is also a space where there is any oxygen or all those sort of things if you are given. And at the very end, there is a space for you to write any notes. Yeah, so this is like a typical a drug chart, which you will see. Now, usually what happens is that when you are doing any drug round or when you are checking for any drug chart, there are these 6 R's that you have to make sure that you know them. Now, if you have given the CBT, then I know that you would have come across the 6 R's. So there has to be the right patient, the right medication, the right dose, right route, right time, and the right documentation. So you have to have all these 6 R's in order to make sure that that medication or that prescription is valid and that you can dispense the medication. Are you with me?
Yes.
So again, all of these things. So when you are actually checking the medication, you will need to verbalize this thing so that I have checked that it is the right patient, it is the right medication, and for that medication, it is the right dose that we are giving. It is the right right route. If it is given as an oral or IM or IV, whichever, it is the right route we are giving. And it is the correct time that it is supposed to be given at this time. And also there is a sign of the doctor and the name of the doctor. So there is a right documentation which is there. And then I'm going to say that, yes, I can dispense this medication. It is a valid prescription. So once I have decided it is a valid prescription, say for example, it is paracetamol, then I am going to pick up paracetamol from my trolley. And then I'm going to check that, okay, this is the paracetamol. This is of the same strength that is written in my notes or in my chart. Yeah, I have then checked that it is within expiry, that it is not expired, and it is a sealed bottle. So I know that it has not been contaminated or tempered. And the doctor has mentioned that you have to take 2 paracetamol of 500 milligrams. So I'm going to take out 2 paracetamol in my cup and I'm going to keep it there for the patient to take it. Okay. So it is only once you have shown all these things, then you give it to the patient. So in the mannequin, you are going to pretend that you are giving it to the patient and you are going to give some water as well. And you are going to then check with the examiner or the patient that yes, whether he or she has swallowed the tablets. Yeah, once the patient has confirmed that yes, they have swallowed the tablet, it is only then that you are going to sign the chart. Yeah, because it is only then that you will consider that you have actually given the medication. Yeah, before that, it is possible that the patient has taken it in his mouth and not swallowed and then spit them out. Yeah. So anyone wants to ask anything over here? Okay. So so it is. Okay. Someone needs to mute their.
Some disturbance.
Yeah, please, everyone, please mute your mic. Okay, yeah, so just moving ahead. So we know that now how to or what to check when we are doing an implementation station. So we carry on going through all of this thing in the systematic way. If we come across anything which I feel that, okay, this paracetamol dose is not correct. Yeah, so then I'll say that, okay, the dose is not correct. It is an invalid prescription. So I cannot give this prescription. Now, when you say that you cannot give this medicine, you have to, in the end, that where I was telling you that there is a space for you to write the remarks, you are going to write over there that, okay, you have not given this medication and you will need to write the reason for not giving that medication. Yeah. Now, usually there is in the front page itself, there are the list of reasons and they have been given numbers. I'll show you the drug chart and I'll show you that as well. So you can just pick from there and you can write that, okay, this is the reason that you have not given the medication. Okay. So this way we go through the entire drug chart and give whatever medication we can give. And if we can't give anything, then we are going to explain that why we cannot give it. Now, it is also very, very important over here that you know about the medications, because one of the main problem that I have come across is that people, they do not read about the medications. Yeah, see, if there is something which comes up, which say, for example, someone came across nitrofurantoin. Now, if you don't know the medication, how are you going to know that whether the dose which is there is correct or not? Or what are the reasons that, for what reason it is being given? Yeah, until and unless you don't know that, you will not be able to find out that whether it is the correct medication or not that you are giving. Okay, so we will give you a list of common medication, and you usually will get a lot of practice as well, that okay, these are the common medication, what is their dose, side effects, and all those kind of things, because sometime examiners, they might ask you about these things. Okay, so this is one station where you have to be very, very organized and thorough, and you have to have the knowledge of the medication. Then we come to evaluation. Now, evaluation is again the silent station. You will get 15 minutes for that one. Now, over here, you will be given a blue pen to write it. Now, the reason again for the blue pen is because in this station, you will get all the papers of your previous station. So you are going to write, say, for example, a transfer letter or a discharge summary. So for that, you will need to know that what was your assessment, what was the planning that you did, what was the medications that you gave. So all the papers from the previous 3 stations will be given to you. So you can look into those papers and then you can write your evaluation. Okay. So remember that you wrote your care plan with a black pen. And that is why they are giving you a blue pen, so that you cannot make any changes to any of those things. Okay, so this is the reason for that one. So over here, you will need to write a transfer or a discharge letter. It is again a very, very simple station, because most of the things you will need to just copy from what you have already done. Okay. And in this one, and even in your other writing station, just make sure that you are not using any unknown abbreviations. It is always better to write the full form of the thing. And again, your writing should be clear and legible. Yeah? Okay, so now we come to skills. So I'll take you through them fairly quickly, because I'm aware of the time as well. So in the skills, there are around 10 skills which are there at the moment. Although the skills, they keep on adding, and so by the time you will come, I'm not expecting that they are going to be adding any new skills at least for you guys. Yeah, but currently there are 10 skills. So out of those 10 skills, you will be given 2 skills to do. Yeah. So the time duration it varies according to the skills. But there are from 8 minutes till 15 minutes. So that is the time period that you are getting. And we will come, I'll tell you what all other skills are there and what are the times that is given for them. So as I've already told you earlier, that skills can be either before API, after API, or one skill before and one skill after the API. And all of the skills are done on the mannequin. Now, these are the 10 skills which are there. Yeah, so you get a basic life support. There is an ANTT, which is an antiseptic non-touch technique. So this is the one which people find the most difficult one, more because of the time constraint. But if you do it with practice and with planning, I think 15 minutes is enough time for it. Yeah, so this is the one which you have to use the absolute sterile technique to change a dressing. Okay. Then there is 3 stations which are related with the catheter, and the urine. So one is the midstream urine specimen. You have to check like a dipstick. This is the newest station which they have added. Then there is a catheter specimen of urine. So you have to take a specimen of urine from the catheter. There is a removal of catheter. Now, if you will see, the basic life support is for 8 minutes. So because there is not much that needs to be done in that station, and so you are given 8 minutes for that. ANTT, you are given 15 minutes. MSU, because it's a new station, they have still given it 15 minutes. The catheter specimen and removal of catheter is 12 minutes. Now, if you do it correctly, usually they don't take more than 6-7 minutes. Yeah, so it is more than enough time. 12 minutes is more than enough time in that one. Then there are two injectables, IM injection and the subcutaneous injection, for which you are given 15 minutes each. Then there are two stations which are more related to patient education. Now that is the peak flow and inhalers. Now I'm not sure that whether you guys know about peak flow or not, because it is an equivalent of spirometry. In India, we do spirometry rather than peak flow, but in UK, we do peak flow. So it is an equivalent of that one. Very, very simple, easy station. And then there is inhalers. Inhalers is where you are teaching someone about what are the technique of how to do, take the inhalers. You know, the salbutamol, beclomethasone inhalers. And then there is a fluid balance chart. Now, fluid balance chart is again a silent station where you are given, it is just like a history of a patient in which they are going to, like a story, they are going to say that, okay, in the morning they had 100 mils of water and then they went to the toilet and it was equivalent of 500 mils of urine that they passed and all that sort of things. And then you are given the paper in which you have to write the input, output, and the total fluid balance you have to take out. Okay. So these are the 10 skills out of which you will get to do 2. Now coming to common mistakes and errors. Now it is again a very, very, you don't have to use much to know that what can be the common mistakes, but lack of communication, both verbal and non-verbal, is one of the major sort of things that people find is the common mistake. Now I know that everyone, because you are nervous, that is the reason that sometimes you don't do what you normally do in your day-to-day practice. Also, which is not mentioned over here, but I just remember, also one of the common mistake is that you acting like a robot. Yeah, because see, sometimes what happens is that if you are practicing something in a certain way, you get used to that way. It is almost as if, like, you know, the tables, when you learn timetables, there is a way that you learn those timetables. So if I ask you that timetable in a different way, suddenly you wouldn't know the answer. But if I ask you exactly in the same way, you will say the answer in 1 second. Yeah, so we have to make sure that we do not become robots. Yeah, so those things that we learn, we are learning only to make sure that, okay, we have a plan or a sequence in our mind. But it shouldn't be that if there is that sequence is disturbed, then that we don't know anything, or we are suddenly disturbed and then we are suddenly sort of getting very nervous. So when you will come to us, we will give you enough practice of this as well. We will try and sort of disturb you in between. We'll try and make you nervous so that you get used to the being nervous and being starting things from in between. Okay. So then the second thing is that not reading or understanding the scenarios and instruction. So most of the time, the 5 minutes that you get, people, they just skim over the question. They do not really read it very very thoroughly or very properly, because they are in that information. Every line of information is very, very important in that scenario. So it is very important that you utilize those 5 minutes and read it properly, that what are they trying to say. There might be some clues in over there, which you will have to do or not do when you go inside. Okay. Then there is time management, that sometimes people, they take more time in introducing and doing all the niceties. And suddenly they realize that, oh God, now we don't have time. So then they start doing things quickly and then they fumble and make mistakes. So it is very important that you do, your time management should be in such a way that you are able to complete the station. Hand hygiene, infection control. It is very, very important that you follow the hand hygiene and infection control routines. Then not checking for common things like allergies or patient identification, not taking consent from the patient, or not caring for the patient's safety or privacy. So these are other things. And then another most common thing is incorrect or incomplete documentation. So imagine that you have given the medication, you have done all of the implementation very well, not even a single mistake, but you forgot to sign it. That is a short fail if you forget to sign it. You have written a care planning very well, everything was absolutely very good, but you forgot to sign it. Yeah. So if if you make these type of mistakes, then this is a very costly mistake. Yeah, so just make sure that you, again, we will be telling you time and again that how important it is to make sure that you do the correct documentation and signing, and a complete one. Okay, now I just want to tell a little bit about the OSCE results. So this was the exam. Now in the OSCE result, there is a pass, and then a partial fail, and then there is a full fail. Okay, a pass, obviously no brainer, you have to pass all the 6 stations and you are a pass. Then there are, like, if you fail, and if you fail up to 4 stations, it can be either APIE or skills. Out of 6, if you fail up to 4 stations, then you will need to resit those stations. Okay, but you will need to resit the same station and only those stations which you failed. Say for example, if you failed in planning or if you failed in implementation, you will need to give only planning and only implementation, and the scenario is also going to be the same. Okay, so it is almost the same station you will have to repeat. So you already know the question as well, that what is the question. So you know the scenario as well, that what exactly it is. You will also know what mistake you made last time. Yeah. So when you are giving a reset, and a reset is going to cost you 50% of the fees. So a full fee for the exam is £794. So if you are giving a reset, a 50% reset, you will need to give £397 up to 4 stations. Okay, so 4 stations in £397 up to that one. But if you fail 5 stations or more than 5 stations, then you will have to give 100% fees. Yeah. And so you will get 3 attempts in doing that. Your first, second, and third attempt. Between each attempt, you will need at least 10 working days in between your last appearance and your next exam. If you fail all the 3 attempts, then you will have to wait for 6 months and you will have to start the process again. So you will have to reapply for the NMC for the for registration. Okay. So is everyone clear with this one?
Yes.
Yeah. So thankfully, hopefully all of you will pass in a first go. And I am almost 100% sure that everyone will pass in the second attempt, just in case if there is a station or thing that you might not have been able to pass in the first go. Okay?
Okay.
Fine. Then some general tips. Again, they are no-brainers. So stay calm, practice. Read the scenario and instruction properly. Your time management. So you come on time for your exam, check all of your documentation, make sure that you have all the documents with you. What you don't want is that sort of makes you disturbed for the exam. Yeah. Then self-care is there, that you have to rest well before the exam, drink enough, eat, because I know that quite a few people, they are too nervous to eat or drink anything before the exam. But you do need all that glucose to make your brain working. Yeah, so look presentable, but avoid anything which is the cause of infection. So all these things we will obviously, when you are coming for the exam, we will give you all that, what exactly you need to wear, how you need to look, and all those sort of things. So we will go in more detail in those ones at that time. And then it is just thank you and good luck. So these are one of our batches of nurses who had come. So we took them out to go and see London. And this is how they enjoyed being in London. Okay. So now, is there anything that you would like to ask from this one? Yeah, from this presentation, is there anything that you would like to ask from this one? If not, then I can go to the other one where I can just, let me bring up the charts that we were discussing. Yeah, please ask if there is anything while I'm bringing up that thing. Okay, can you see my screen?
Yes, ma'am.
Okay, so if you take it from here, yeah, so you will see that this is the type of things that you will be getting. Okay, so this is like the question. So this is something that, so this is the scenario, and you will be, there is a scenario which will be written over here, and they will give you the time and today's, like assume it is today and the time. Yeah. So this is the thing which you will be given to read before you enter into the scenario. So after you have done, so inside when you go, this is what you are going to be getting, a paper which is going to be over there, in which you can write your notes. So this is not something which is marked. So as they have written over there, this is nursing assessment candidate's note. It is not marked. So you can just, while you are giving the history or you are taking the history or whatever you are writing, say if you're doing a respiratory rate or something, if you need to make notes, you can make on this one. This is not marked. Okay. So, but this is going to give you a little bit of an idea that what are the activities of daily life that you need to ask. So this is going to prompt you that, okay, the mobilization, the sleeping, elimination, all these things, and pain, communication, all these sort of things you can ask the patient, and you can make some additional note. So this is for the assessment. Then you come to the planning scenario. So if you come to the planning, you will see over here that in this one, this is exactly the thing which is going to be given to you. This is a scenario again, which is going to be written on the day, and you will need to read this before you enter the station. Okay. So after that, this is what you will be given to write. Okay, where I was telling you that you will need to write two of the problems. So you over here, you will write the patient details. Then this is your first problem which you are going to deal with. Okay, so you are going to write a problem over there. You are going to write the aim of the care. So say for example, if the problem is that the patient is in pain. So pain is your problem. Now what is your aim? Your aim is to bring down that pain. So the pain you will write that, okay, patient is suffering with pain due to the dog bite, and it is evidenced by the pain score of 8 out of 10. So now this pain score you have already checked when you are doing the assessment. So this is how you write your nursing problem. Now the aim of your care is that the aim is to bring down the pain score from 8 to 4 in the next 6 to 8 hours. So re-evaluation, then comes the re-evaluation date. So re-evaluation is that when you are going to re-evaluate the care plan. So now you are going, you have put the aim, about that you are going to give the painkillers. Now painkillers, it is going to take at least, you will give at least 2 doses of the painkillers for before you say that okay, now the pain is really less, yeah, to reassess the pain. So you will say that okay, I'll come back in 6 to 8 hours to reassess this or reevaluate my plan, because that is enough time for me to give 2 doses of paracetamol, and 2 doses of paracetamol should be able to bring the pain down. Okay, so I should be able to achieve my aim, which I had set, of bringing down the pain from 8 to 4. So now over here, you are then going to write in detail. So you have made the aim, you have made the, you have given the problem. Now, how are you going to achieve it? This is what you are going to write over here. So the pain, you are first going to explain it to the patient that what we are going to do and gain the patient's consent. Okay. The second thing is that you are going to make sure that you give them the comfortable position. Comfortable position might be that you might have to give them a pillow under the leg. You have to raise the leg. You have to or give them the pillow. Otherwise, you have to give them something to eat and drink so that they are otherwise comfortable. They might want to have some music or something. So you make them comfortable or put them in a comfortable position. Then your next thing can be that, okay, you are going to give them the pain medication and make sure that you tell them that it is, that they have taken it, and they can tell if there is any side effect or any problems with the painkillers. Yeah. Then you are going to say that, okay, I'm going to give a call bell to the patient that just in case if there is any problem, they can always call us and we can come and see. You are also going to document what you have done and all those things. So these are the type of things that you are going to write in a care plan. Then if you see that in this side, there is a patient self-care activity. Now, self-care activity is something that, see, in order to make the patient better, you have to not only, it is not just your responsibility, it is the responsibility of the patient as well. So the patient is responsible to tell you that whether if the pain gets worse, yeah, or if they feel that they are getting any side effect from the medication, or they are going to make sure that they keep themselves hydrated. Yeah, you have kept a jug of water with them, but now it is up to them that they need to keep themselves hydrated or keep on drinking. So these are the, for every activity, like say for example, you have taken that you are going to ask for the patient's consent. So in the self-care, you are going to write that the patient is going to be able to understand the information and give his consent. Okay, so that is the patient side. So you will have to write both the sides, that what is your responsibility or what you are going to do and what the patient is going to do. Okay, so that is going to make a care plan, because now both the parties which are involved know what are their roles and responsibilities. So you will have to write 2 of them. So that is the first one, and this is the second one. If you see, this is exactly how it is scored. So this is the only space that you are going to get. So you have to make sure that you are concise and you are to the point in this one. And under each of them, you have to write your name, you have to write, you have to sign, and you have to put the date. Okay. So this is for your planning. Now, they have given one extra page that just in case if there is any problem, they usually will give you an extra page that you can just use that one. Now we come to implementation. Now in the implementation, again, this is, you will get a scenario. Yeah. So over in this place, they are not going to give you the drug chart. They are only going to give you the scenario. The drug chart is when you go inside, then you will find the drug chart. So this is how a typical drug chart is going to look like. So there is a prescription chart of the patient's name, their gender, and their other hospital details are going to be over there. Their admission sort of date, you find out about the allergies and the type of reaction that they get. Yeah. And the thing that I was telling you, that they usually will have a place where they will say a common conditions for not administering the medication. This is what it is. So the patient is either not in the ward, or it was omitted for a clinical reason. Medicine is not available. Patient refused the medication, nausea or vomiting, or illegible or incomplete prescription, wrongly prescribed, nil by mouth, no IV access, or other reason. So these are all the reasons. So inside when you go, if you find that, okay, patient is not in the ward, so you cannot dispense the medication, in the chart, you can write just one number and sign it, because they know that one number means this one, patient was not on the ward. Okay. So then you come over here. If the medication are not administered, please document on the last page. So in the last page of the drug chart is going to be over there. So inside, against the medication, you will write number 1 and sign, but at the back of the page, you are going to give the detail of this one. Okay. So now when we come to the drug chart over here, so this is, as I was telling you, that there will be a stat dose. So they will have over here, they will fill out everything. So date, time, drug, dose, route, prescriber signature, their bleep number, and given by who gave it and at what time it was given. Now this is very important in the things like, say if there is someone who came with pain and you gave the paracetamol as a stat medication over here. Yeah, so the paracetamol as a stat medication is given, but later on you will find that there is a paracetamol which is written as a regular medication as well. Now, paracetamol, the time duration between two paracetamol has to be at least 4 hours. So sometimes people fail to notice that over here, the medication was given at 12 o'clock in the afternoon as a stat medication. And now you have gone to give the patient regular medication at, say, for example, 3 o'clock. And the patient is saying that I'm still in pain and I want my painkiller. If you give the paracetamol, which is written over there, then you will fail. Because you fail to notice over here that the paracetamol has already been given just 3 hours before. So you cannot give it until 4 hours have elapsed. Got it?
Yes.
Yeah. So it is very important that you take notice of what is there on the stat dose. Yeah. Then there is oxygen therapy. So sometimes they would say that oxygen therapy has been started, but in the notes it is written that if the oxygen saturations are more than 96%, then you can stop it. So if you have done your observations and you find out that, okay, it is more than 96%, which was there, then you can stop it and you can write it over here. Then there is the PRN medications which are there. So PRN, everyone understand that these are the as and when required medication. Yeah, so sometimes the like the antiemetics and things, they are written over here. So there might be cyclizine and all those sort of things, or maybe antacid tablets might be over here. So to be given only if required. Okay, then you come to the routine medication. Now in routine medication, as I was telling, that usually they start with the antibiotics. So over here, it is going to be written over here. So there is a name of the medication. So when I'm reading this chart, I'm going to say that, okay, my first R is the right medication. So I'm going to make sure that it is the right medication. There is a start date. So this goes in the right documentation. So it is the start date and a finish date is written over here. Right dose is there, right frequency is there, right route is there, and for how long it is there, and the prescriber signature and thing is there. Yeah. So I'm going to check all these things and I'm going to say that, okay, there is a start date, there is a finish date, there is a prescriber signature, it is the correct dose of the medication, and it is the time, like it is due now. So I'm able to give this medication, and then I'm going to give that medication and I'm going to sign it over here. Okay. If I'm not able to give for any particular reason, I'm going to mention that reason over here and sign it. Got it?
Yes.
Good. So same way it is going to carry on. So all of the medication are going to be over here. Then you come to your regular medication in that paracetamol or ibuprofen and cocodamols and all those sort of things will be there. Yeah. In these ones, sometimes it is patient's own medication are also there. Say some patients are hypertensives, so they have been on antihypertensives for a very long time. So those are the medication which are not new medication. They are old medication which have just recently been, or which have been added to the drug chart because the patient takes them every day. Okay. So then comes the IV fluid thing. So this is there, like you will have to check. So if someone is on the IV fluid, you have to make sure that that you are checking the patient's cannula, you are checking that the cannula is not, there is no infection around the cannula, patient is not in pain because of that, and you will also check that it is the correct fluid which is going on and when it is going to be likely to finish, the batch number and all those is correct. Okay, so you will have to make sure that you check all these things. So this is where your drug not administered. Yeah, so if any drug which you have not administered, this is where you are going to write the reason and the details of that. As I was saying that if I have not written paracetamol because the patient was not in the ward, so I'm going to write the date, time, the drug which was not given, and the detailed reason that the patient was not in the ward. And then I'm going to write my name and sign. Okay. So this is basically the drug chart, and it always comes in the same pattern. Now comes your evaluation scenario. So evaluation is again, they are going to give you this chart there, and it is in the blue pen, and you will get all of your documentation back, and this is how you will need to write. So there is a transfer of care letter. So there are patient details you will write. You will write the reason that why was the patient admitted and what was the diagnosis, the date of admission. So you know all these things, you already know them. You just have to copy from the previous things. And then that why the patient, what was the main nursing needs of the patient addressed during. So these are the two things which you have already written in your care plan. Yeah. So all of your nursing care which you gave, you are going to write over here. And then you are going to write the patient's, outline the patient current ability of self-care. So you can write over here that, okay, the patient can mobilize themselves to the toilet, the patient is able to verbalize their pain scores and things, the patient is able to eat and all. So what currently what they are able to do, you are going to write that one. And if there are any allergies and things, you are going to write. And then this part lists the area of health education. This is the part where you can actually show a little bit of your depth of your knowledge. Yeah, so you can say that, okay, while the patient was in the ward, we noticed that the patient is a smoker and he's hypertensive as well. So we would advise that the patient provided with health education regarding smoke cessation. Yeah, or it is also possible that the patient is advised to see a physiotherapist, or it is advised that they go for, they are very anxious person, so we have advised them to take up like yoga kind of thing, or to do breathing exercise, or to do meditation, all those kind of extra things which you can tell the patient. Okay, so then the date and time of the transfer and your sign and all those things. So this is like a transfer care that you have to write. And there is another one where you have to write the referral one, so which is exactly the same that you have to write, same set of things. Okay, these are the two type of things that you will get, either a transfer letter or a referral letter for the evaluation. Now in the skill stations, you will get something like that over here they are going to tell that, okay, that you do a dressing change, or you do a IM injection, or you do that you need to tell about the inhalers or peak flow or something of that sort. You will have to write in this type. So if it is going to be like you are giving some injection, so then you will have to fill this chart up. You will have to write the medication, the batch number, and because it is just like giving the implementation kind of a thing. So you are actually giving the medication rather than oral, you are giving an injectable form. Now the charts that I was telling you, let me first come to the, so first if we go at the in-hospital chart. Yeah, so in hospital we had two. So there was a news chart and there was a GCS chart. Yeah, so this is basically your news chart. So in news chart, you are going to write your full or the patient's name, date of birth, date of admission. Yeah, then the date and time when you are doing the observation. This is the chart which you are going to get if you have to do a news scoring. Okay, so you have already taken the patient's respiratory rate. So the patient respiratory rate is say for example 21. So you will have to write over here 20 between the of the column 21 to 24. You will need to mark it over here. Okay, they are on oxygen. They are not on oxygen, and the oxygen saturation is more than 96%. So you will write it over here. You will mark it over here in the 96, more than 96 one. In air or oxygen, depending upon they are not on oxygen, so you are going to write air. If they are on oxygen, you are going to write an oxygen, but otherwise you write air. The blood pressure, normally you will go in you will draw a line, a dotted line. So it is like, say for example, it is 140 by 90. So it is the upper reading which is going to matter. Yeah, so you start from over here and draw a line. So you start from over here and draw a line till over here. Okay, and you are going to mark with arrows on both the sides. Then pulse, you are going to write whatever the pulse is. And you are going to write whether the patient is alert or confused. And you are going to mention the temperature. Now in this one, depending upon where you are reading from. So if your reading is coming in the white columns, then the score is, then you are going to give a 0 to that one. Your score is 0. This in between the numbers that they have given, these are the scores. Yeah. So anything which is in yellow gets a score of 1. Anything which is in this peach color gets a score of 2. And anything which is coming in this red color gets a score of 3. So when you are marking it like that, you are going to then calculate the score according to the color band where your reading is. And you are going to write a total score over here. Got it? Yeah, so you write a total score over here. Then you will also be provided with this key. Yeah, they will give you this key. For example, say your score is between, so your score is 3. Yeah. So it is coming over here. Now the frequency of monitoring they have suggested is from 4 to 6 hours. So over here, monitoring frequency, you will need to write 4 to 6 hours over here. Okay. The next thing is escalation of care in this, yes or no. So when you are at 4 to 6 hours, they have said that you have to inform the registered nurse who must assess the patient. So you need to escalate it. Do you understand the meaning of escalation? Escalation is when you are going to tell someone senior to you that if there is something which they need to check. Okay. So you have to accept when the score is 0. You have to escalate in all of the scores. Got it?
Yes.
So this is, and then you have to write your initials over here. So it is a very, very simple form, but it is something which you have to be very thorough with it. You wouldn't believe that I have people who failed on this chart, filling the chart. Yeah. So I think that it is very important that you know how to fill this chart and you practice filling this chart. And most importantly, that you finish this chart in time. So usually it is always better that while you are taking your observation, that say if you took the temperature, as soon as you took the temperature, you have marked it in the chart itself. As soon as you have done the pulse, you have marked it in the chart itself. So that you are you are not forgetting, and B, you are saving time. You are doing it side by side. Okay. So this is your news chart, and this is how you will have to fill the news chart. Now the other one was your GCS chart. So this is the GCS chart, which is the Glasgow Coma Scale. It is similar to the one like the news chart, but in this one, if you see that anyone who comes with a neurological problem, the time or the duration that you are going to review them is more. So you will, after almost half an hour, you are having these duration of the review. So in this one, the extra bit that you will have to do is that you will have to do the Glasgow Coma Scale. So you know that it is out of 15, that 15 is the maximum that you can get, and 3 is the minimum that you can get in a GCS score. Okay, so you are checking with the patient. If you are talking to them and if they are opening their eyes, then you know that it is a spontaneous eye opening. So you will give a 4 mark. When you are talking to them and if they are giving you back the correct answer, you know that they are oriented. So you give them 5 marks. And because they are responding to you or they are obeying your command, then you give them 6 marks in that. That makes your 15 marks. Okay. But otherwise, depending upon whatever it is, you are going to mark this one. The rest of the things are similar, but make sure that you understand that temperature over here is on this side, but you are going to mark it over here only. You're not going to mark the temperature over here. You are going to mark it on this side only, but you will see it from this side. You are going to see it from this side. So say if I'm writing blood pressure, so my blood pressure, I'm going to mark it in an arrow. And my temperature, if it is 38, I'm going to mark it over here as 38, the temperature. Okay. Then we come to the pupil size. So these are the pupil size they have already given. Normal size is around 3. So this is, you are going to write over here that size and the reaction. So you know that you are going to do it with the light, and the pupils, they should constrict, which is a normal reaction. And so they are reactive. They should be reactive to light. Okay? If the patient's pupils are not reactive to light, they are dead. Or at least there is some problem with the brain. So this is how you check when you are declaring someone dead. This is one of the things that you are going to check their pupils. They are stable and they are dilated. Okay. So you write the size, what is the size of the pupil, and you are going to write the reaction. They are reactive. Then you do the motor. So you are going to check the motor system as well, where you are going to check their limbs. So you are going to check that there is normal power in both the limbs, or there is any weakness, and upper arms as well as the lower arms. Okay, and you are going to write a total GCS score over here, and you are going to write the oxygen saturations. So even this one is a fairly simple chart. Again, we will give you enough practice to do this chart as well. Okay. Now we come, so these are the two in hospital scenarios where you will need to do a GCS and a news chart. Now we come to the community setting. So in the community setting, there are 3 types of chart that you can get. One is the simple TPR chart, which is going to come somewhere over here. Yeah, so this is a simple TPR chart, an observation chart. So this simple TPR chart is like, as you see, they have even said, so blood pressure, usually you will write it like that with a dotted line. This is the pulse and this is the temperature. Now in the TPR chart and in the GCS chart as well, the most common mistake that people make is about the temperature. You have to make sure that the temperature is written on the right hand side, but you have to mark it against on the left hand side against that date's marking. You shouldn't mark it over here. That is wrong. Okay, this is just because there is not enough space and all that they have given to make the chart concise, they have made it over here. So when you are going to write your blood pressure, you are going to draw it with a dotted line. When you are going to do a temperature, you are going to write a cross. So if the temperature says 37, you are going to make a cross over here. Okay, and the pulse, if you say the pulse is 80, you are going to write a dot over here of the pulse. I hope everyone has understood it. Respiratory rate and your initials over here. Okay, so this is a simple TPR chart that you will get for the community assessment. Okay. Now in the community, the other chart that you normally get, you don't have to fill that chart, that will be filled, but you might have to calculate the score, is a PHQ-9 chart. Now a PHQ-9 chart is a chart which tells about the patient's mental state of like in the form of depression or they are anxious and all those sort of things. Yeah. So this is the chart. This is the PHQ-9 chart. Now usually this chart is going to be filled. Now by filling, I mean that they would have marked it over here, that 0, 2, 1 and all these sort of things they must have marked. And then you have to add the columns together and you have to give a total score. Now in this one, if you read like the questions, so you are going to try and check the patient's state of mind and be aware that it is checking in the last 2 weeks. Okay, so you are going to ask the patient that in the last 2 weeks, have you felt that you have got little interest or pleasure in doing things? Yeah. So I might be sort of in a bad mood today. So, but it is not checking my today's thing. I am checking for the last 2 weeks. And that is why if you are asked that, okay, when are you going to repeat the PHQ-9, you will have to tell that at least in 2 to 3 weeks time, you are going to check it again to see the effect of any medication or any intervention that you have done. Because less than 2 weeks is not the correct time for it to be checked again. Okay. So you will be given a total score, or you calculate the score over here. So say if there are 2 1s and 3 2s, so it is 8 and 1 3, so you get a total score of 11. Yeah. Then they have given you a key over here. So a total score of 11 means that you have got minor depression. Now with minor depression, what you have to do, that you have to do support and watchful waiting. So you can tell the patient that, okay, we are going to keep an eye on things. Your score is telling that you might be slightly depressed, but I think that we can help you out with this one. If there are certain activities or certain things that you want to do, maybe go out for a walk, maybe talk to other people, and that might be helpful to lift up your mood, but we will be taking good care and keeping an eye on it. So you are giving the patient support and you are telling them that you are going to wait and watch and see. But if the score comes back as 15, then you know that patient is in depression. So in that time, you will have to say that, okay, I'm going to refer you to your doctor, to the GP, who will most likely be starting you on some antidepressant medication and also start you on some counseling. Okay. So this is the PHQ-9 that which I was suggesting that you can get it as one of the community scenario. Okay, now we are left with only one. Not sure. Okay, there is another one, a peak flow chart. Now this peak flow chart is the chart which you, it is one of the skills chart. So when you do the peak flow is basically done to check whether your asthma is under control or not. So when you do the peak flow, you will need to chart it over here. Your readings you will have to chart on this one. So this is dependent upon the age and the height of the people, and male and female, the gender as well. Yeah. So again, when you are going to be doing this and when you will come, we will give you enough practice to do fill out this form as well. Okay. So these are the most common one. Now this leaves us with only one thing, which is a new station which have been added. It is not new anymore, but it has been added for some time. It is the must score. Now must score is the thing that you do in order to figure out that whether the patient is malnourished or not. So that is the nutritional assessment that we do. So I'm going to stop this one and I'll try and see if I'm able to bring up the must score. So I'll show it to you in a. So I know that it is a lot of information in one go. I hope that you guys are not getting too confused. Yeah, so today's thing was more of just that you should be able to see that what is going on and what all these things which you will be come across. So at least when you come across these things, you should be able to see that, or at least recognize that what these are. Okay, so okay, so are you able to see this? I'm just going to make it a little bit bigger. Okay, can you see this?
Yes, ma'am.
So this is like how you can calculate a must score. So it has a must score has 3 steps to calculate. One is your BMI, then is a weight loss, and then the acute disease effect score. Okay. So say for example, if your BMI is more than 20, then you will get a score of 0. But if it is between 18.5 to 20, you will get a score of 1. And if it is less than 18, you get a score of 2. Now, do you know how to calculate the BMI? If most of you would know, but if you don't know, then you can just check it out, that how you calculate the BMI, and you will, obviously we will give you a lot of practice for this one as well. Then there is that step 2 is the weight loss. So you have to see that in the last 6 months, that whether the patient has lost weight suddenly. If it is like less than 5%, then you get a score of 0. If it is between 5 to 10%, then you get a score of 1. And if it is more than 10%, you get a score of 2. Then the third one is that if the patient is acutely ill, and or if they feel that the patient cannot have any nutrition intake for more than 5 days. Say for example, in the acute disease one, that you will say, for example, if someone is having laparoscopy done, yeah, or they've had a major surgery done or abdominal surgery done, they will not, obviously they will not be eating for at least 4 to 5 days, definitely. Yeah, so then for those people, you will get you will give them a score of 2, because they are at a higher risk of getting malnourished. Okay, so you will calculate all these scores, and then you will come up to a score, that whether your score is 1, 2, 3, whatever your score is, you will come up to that score, and according to that score, you will give the advice to the patient. So if the score is 0, it is a low risk one. If it is 1, then it is a medium risk. And if it is 2 or more, then it is high risk. So in the low risk, it is a routine clinical care. So you just do, if they are in the hospital, you do a weekly care. If they are in the care home, you do monthly basis. And if they are in a community sort of thing, then you can just do an annual basis, unless something suddenly changes. And the medium risk is, again, you are just going to decrease the amount of the time limit, but otherwise you are just going to observe. And if it is 2 or more score, then you are going to treat them. Now, in these ones, again, you will have to, there is another form which you will have to just fill that up. We'll show you that form once we get nearer to that. Yeah, but it is almost, you can take it as a rule that if it is a community scenario, then your must score is almost always going to be 0. Yeah, because if you are in the community, obviously it means that that you are eating and drinking. You will be eating and drinking something. So your high risk, or your this score, the step 3 acute disease effect score, is always going to be 0. Yeah. It is possible that if you are obese, or if you are, your BMI is too low, then you might get 1 or 2 score of this one. But the step 3 or the acute disease effect score is always going to be 0. So this is the last chart which I wanted to show. Yeah. So I think that sort of, that brings me to this thing, that we are almost the orientation part of your OSCE. So I have tried to cover up everything that you will be facing, and what are the type of things and what to expect in this one. But if there is anything that you guys now have any questions, please let me know. Then I will be happy to answer those questions. No questions? Okay, doesn't matter, because it is going to be from Tuesday onwards, next Tuesday onwards, then most likely Julie is going to start with the assessment. Okay. So how it is going to be is that we are going to show you some video of the assessment, and they are going to show how an maybe one scenario they are going to show, and then they will ask you how to do those things. Yeah. Okay, ma'am. So we will be posting the recordings of each session as well, so that any person who is not able to attend, they should be able to see the recording. But it will be very, very important that all of you do the homework of, because most of the time you will get either homework of filling up the drug chart or you doing the care planning and thing. I think that Rafiz had sent the pre-read material for to all of you. So please make sure that you have gone through them. You have done your drug calculations and things, and you send all the work that you do to Julie and Jane. So if you do not have their emails, then I will put it on the group. Then you can email the material directly to them. Yeah. And then they will give you the feedback on whatever work that you are doing, so that you are able to know that whether what are the areas where you need to improve. Also, we have started our own YouTube channel with a Charcos Learning Center, and we are posting some material on that as well. So please subscribe that, and please share it with your other friends as well, so that we can get the maximum out of that. Okay, but otherwise we are using the group. So if there is any questions or any issues, please let us know on the group. If for whatever reason, if it is, you are not able to attend the session, I'll really appreciate if you can tell us in advance, so that we do not keep on waiting for you. And otherwise, like if I don't think that there should be any issues with this. With today's session, I think that it went pretty well from the connection point of view and all that. And I think that all of you were able to hear and understand what I was trying to say. But any suggestions will be welcome. Okay, so if there are no further questions, then I would like to thank all of you. And I will probably see you again on Tuesday, and have a nice weekend. And if possible, please do your pre-read material, and good luck to all of you.
Thank you, ma'am.
Thank you, ma'am.
Okay, take care then, huh? Bye-bye, everyone.